Hey everyone, my name is Jana Denzel. I'm a dentist in London, UK. And today it is my great privilege and I'm really honored to introduce everyone that's tuned in to the webinar today to probably the biggest cosmetic dentist there is in the world. As a young dentist, I graduated in 2019, and since then I've been traveling the world. And one name in cosmetic dentistry that's always been there, no matter where I go, is Dr. Bill Dorfman. He's been known to bring in cosmetic dentistry to the masses through his hit ABC series, he was featured on Extreme Makeover. He's treated more celebrities than I know. And today he's going to be presenting one of his lectures to us. But even more than that, it is my great honor to say that he's actually going to be coming to London in person on Saturday, 3rd of December. All details will be all emailed out to every single 600 people we've got a list of, so they'll be all emailed out to all of you. It is a once-in-a-lifetime opportunity to see Dr. Bill Dorfman and to really see his work, his lecture, and it's also an incredible lineup of other speakers as well, such as Dr. Miguel Stanley, Dr. Majnaji, the list goes on. So I hope to see you all there. I'm going to pass it over to now my friend, my mentor, Dr. Bill Dorfman.
Jana, thank you so much. I'm super excited to come to London. I am going to give you guys an abbreviated version of a very long lecture that I'm going to do. So you'll get some bits and pieces, and I think it'll give you kind of a nice entree into what we're going to do in the all-day program that Jana has so graciously put together for us. One of the things I love about cosmetic dentistry is really perfecting anterior aesthetics. So I put together a short little course. I'm going to show you how to basically do a smile design, how to prep a case, how to seat a case, and then some really cool new things that we're doing, especially with tissue position on implants. So for those of you who don't know me, I'll give you a brief little rundown. By the way, I just prepped 2 teeth really quickly and I'm sitting in the Leap office here, which I'll tell you about in a little bit. We originally scheduled this for 30 minutes. I'm going to be able to have 45 minutes, so I can do a little bit more than we anticipate, Jana. So I am a dentist, a lecturer, an entrepreneur, a dad. When I did ABC's hit show Extreme Makeover, we were able to literally show the entire world what cosmetic dentistry could do. This was a young woman, Deshante. She's a cleft lip, cleft palate case. These are her submission pictures that she sent us to get on Extreme Makeover. Here she is 5 years later with me on Larry King Live. And this is her before picture on the left and her after picture on the right. Side note, 4 months after we finished her Extreme Makeover, she got married and is still happily married with children and everything. And this is a woman who had never even kissed anybody in her life before because she was so self-conscious. So cosmetic dentistry isn't always about just making people look better. A lot of times it's about giving them confidence in their life. This is another young woman, Becky. She's a bilateral cleft palate patient. When she came in, I told her that we were going to have to extract 11 and 21. And she said, no, doc, I don't want to do that. I had endo, I've had apical, I've had everything. When you pushed on one of her central incisors, the other one also moved. Her entire premaxilla was detached. And I said, look, you have to let me take these out or they won't let me put you on the show. And she said, no, I really want to keep them. I said, Becky, they may not last till you get to the elevator, please. And so she allowed me to do that. And we were able to do this for her. And I won't lie, her husband fainted when he saw her. It was pretty amazing. And then we have these kind of really easy cases. This is Joy Corrigan. She's the new guest model. And, you know, for all intents and purposes, does she have a bad smile? No. By the way, I shot this with my old camera. Are we getting that up, you guys? I shot this with my old camera. Look at the quality of this. Then I'll show you how I take pictures now with my new camera, and I'll show you which one it is. But this is her before picture. All we did were 4 porcelain veneers for her on her 4 anterior teeth. And then we did a little bit of incisal composite on the canines. And watch how we transformed her smile from this to this. And this. Oh, just so you know, I have a few new things. I didn't know these slides were in here. Buzz balls, it's now called buzzer balls. I've created a caffeinated chewing gum, which you'll see in the UK and worldwide. It's a new product. I didn't know I put these slides in, sorry. Oh, and we have a new tooth whitening product called Poof. Okay, porcelain veneers. So the porcelain we use is Ceramco. I only do feldspathic porcelain in the anterior. Every case that I've ever done, every case that you see on Instagram, every case, feldspathic. Occasionally, we'll use Noritake porcelain if we're mixing it with say, lava crowns for implants or whatnot. But pretty much every time I'm just doing straight veneer case, it's feldspathic porcelain. The luting composite I use is Ensure Light Hybrid by Cosmodent, and the dentin adhesive that I'm using is Optibond. The lab I use is Da Vinci. They've done every case I've done since I started my career, and I love them. So the reason I like Ensure is it's got 7 translucent and opaque luting agents. You've got Simulclear, you've got tints, you've got Triangels. It's a great system. If you haven't used it, I'd look into it. And again, I'm running through this, so I'm sorry. Pre-op preparation and smile design. So take your photos. This is the camera that I use. I think it would behoove you to take out your cell phone and just take pictures of the slides that you need. But this is a great camera, and I've tried every camera in the world. This one takes amazing, amazing photos. And all the photos that you're going to see in my lecture were taken with this. So here are her pre-op photos. It's not a bad case. She went through ortho. She didn't like the spaces. She wasn't good about retention. She wanted a little bit more length and a little bit brighter color. Here's the mock-up. I do this free-handed with composite. So here you see the before on top, the mock-up on the bottom. We have to evaluate where we want the tissue. I'll get into this more when we do the full day seminar. I mean, even a case like this, if I were just to change those horrible crowns on her central incisors without adjusting the tissue, we wouldn't really have a success. But just by doing that and changing the 2 crowns on her centrals and then adding veneers on the laterals and canines, we were able to transform this case into this. And this is about 4 or 5 years after I finished the case, and look how beautiful her tissue looks. Tissue doesn't lie. That's one of the best ways to determine success in a case. I like to use triple tray impressions. So once we do the mock-up, DenMat has a clear bite. I actually invented that material. It's a clear bite registration material. We take a triple tray bite. Sometimes it's hard to extrude that. So we started using this gun by Practicon. It's an electric gun. Prep protocol. I make guide cuts. So what we'll do is we'll anesthetize the patient, reduce to uniform thickness. I would take photos of these 2 slides. So on the anterior maxillary teeth, we want about 0.5 millimeters of reduction, about 0.3 millimeter margin, just a chamfer. On the mandibular incisors, we don't actually put a chamfer. If you could put that up on a box right there, that'd be awesome. We don't do a chamfer. I just take about 2 millimeters off the incisal, and then a little bit of a preparation on the buccal, and we always break contact on these. If we need to cover up a darker shade, we may do a little bit more intense kind of reduction where we might go to 0.7 millimeters, sometimes even more if it's a non-vital tooth. This is a trick that I developed. So once we do this mock-up, if you were to prep all 6 teeth and send that to the lab, sometimes they have a problem getting the, how come I'm so far behind? That's weird. It's not live though. Look. It's a lot. Oh, I guess, okay. That's crazy. All right. So, so sometimes we have a hard time getting the incisal edge exactly even or the buccal contour. So what I do is I do this prep guide, and the prep guide, I'll just prep one central and one lateral, and I'll take an impression. And that way the lab can match the buccal contour and the incisal length exactly. After that, I go ahead and prep the rest of the teeth. We put a little chamfer on the lingual of the incisals. We always want to make sure we have at least 1.5 millimeters of clearance. You can squeeze by with one, but I absolutely prefer 1.5 millimeters. Refine and smooth, take an impression. This is a product called Expasil. I honestly could not practice without Expasil. I have never, ever, ever packed cord since I discovered this material. It's a hemostatic agent in a paste that retracts the tissue. It's aluminum chloride is a hemostatic agent, and it's phenomenal. Take a picture of this slide. I'm not going to go through it. So if you see on the left side of the screen, this is before we placed Expasil. On the right side, that's what the Expasil looks like. You can see how it even blanches the tissue. And we also use these little cotton compress caps. And if you look on the right, look how nicely retracted that is without traumatizing the tissue, with no bleeding, with no leakage. It's really a fantastic material. So here we are after the impression. We do a white bite just to verify the bite, especially with the double tray. Sometimes patients don't bite in the correct position. Now we're going to make the provisionals. If you want to remove them, you'll put KY jelly on. I usually don't. I let them lock in. Go ahead and fill the clear bite tray and then flow it around the teeth. We pull out the tray. This is what we have. They already look pretty good. Contour. If there's little voids, you can fill those in. Finish the margins. We use a small composite finishing burr. Pumice to polish, adjust occlusion. If you're concerned about patients' hygiene, you might send them home with Paradex. On the cementation appointment, we'll go ahead and we'll get the veneers, inspect them, make sure that they're etched. Check the marginal integrity. Here we have them on the models just to make sure everything's fine. Now, this is a case where I did my prep guide above, and if you look and see, the central and the lateral are too short. So ironically, this patient called me and said, "Hey, doc, I actually want my teeth a little bit longer." So being short was bad enough, but the fact that they wanted them a little bit longer, I always call my patients after I have temporaries on just to make sure that they're happy with everything. And if they're not, I'll have them come in and adjust things. So we went ahead and we sent the case back. I had the lab remake it, and you can see on the model below, they are a little bit longer than they are in the prep guide. This is called the Seymour retractor. This is another thing I invented. I love this thing. It really holds your lips and cheeks out of the way. You can buy this at Dennat. We go ahead and at first, all I do is I remove half of the temporaries. And the reason I do that is I want to compare the new veneers to the length and the contour and everything of the temporaries. And you can see we're spot on here. So obviously the new veneers are on the right side of the screen. The temporaries are on the left side. To remove the temporaries, we just basically make a little slot between each tooth and then a slot right down the center of the tooth. And then we use an instrument to just kind of snap those apart. After we remove the temporaries, we wash with water, chlorhexidine, pumice, try them in. So here we are in the try-in. Now, The only concern I had, I was happy with the anatomy, with the contour, with the shade, with everything. If you look right between the two central incisors, I'm a little bit worried that we may have a small gap there. So I go back to her pre-op photos and I could see that the tissue actually will rebound, will come right up in there. So we went ahead and we seated the case. So here we are at the try-in phase. I always have my patients sign an approval form. I will put it on the website for the seminar. When we do the seminar, you're welcome to copy this and use it. We re-anesthetize the patient. This is called the ZMAX sponge, or you can use a large 4x4 just for isolation and to keep it dry. We then place Expasil. Even if the tissue isn't bleeding, what the Expasil will do is it will really dry up that sulcus so it's bone dry. I hate when you have a patient come back, you have porcelain veneers that you seated, and now there's this black line around the veneers from leakage, right? We're now going to prepare the veneers for cementing. This is a beautiful appliance. It's a crown and bridge organizer. And we place this, I know this is an 800 number. When I come to London, I will give you guys a number you can call internationally for the crown and bridge organizer. But we place one veneer in each slot and fill it with resin. We then etch the teeth for 20 seconds, dry, bone dry, and now apply Hurasil. Hurasil is benzalkonium chloride, hydroxyethyl methacrylate, water, and fluoride. This will create it will desensitize the teeth, and it will create a hybrid layer inside with the bonding resin that you're going to place. So you dry that immediately. Yes, this is Hurasil. And now we're going to apply the bonding agent. Now, I applied 2 coats of OptiBond, and this is probably the most critical thing of all. You must wait 30 seconds before you do anything. Why? It has to saturate those tubules, and it needs to sink into the tubules. If you air dry this or cure this too early, you will have sensitivity. So the best way to avoid having sensitivity is to make sure that you really saturate those tubules, let this soak in for 30 seconds, then you dry it, then you cure it. And now we're going to go ahead and seat the restorations. I always start with the centrals, laterals, and then kind of work your way back. Once you get them in place, you can gently floss them. Sometimes I do, sometimes I don't. Sometimes I cure a little bit and then floss. When I do the live program in London, it's going to feel like we're doing a hands-on course because I have video showing how I do a case from step to step. And it's literally like you're sitting in my dental office with me. So I hope you guys do attend. So we'll go ahead and cure this. And then what I'll do is I'll have my assistant go around each tooth. And as she's doing that, I'll take a small green handle knife and gently remove the excess resin on the buccal surface of the tooth. Once we've done that and the veneers are literally tacked down, we'll go through them with a little serrated saw we call that a tooth saw. And then I check the linguals to make sure that it's completely sealed. I add a little bit of resin there. Go through all the contacts, adjust the occlusion. The only thing I do on the buccal of these teeth is I polish it with a silicone blue cup. I never use rotary instruments on the buccal surface. I don't want to scratch that surface up at all. On the lingual, it's different. We'll go ahead and we'll adjust that, polish it. Here we are immediately post-op, and here she is a week later, and you can see how beautifully that tissue came down between those central incisors. And here she is done. So I'm going to share a few what we call porcelain pearls on some kind of complex and different cases, short margins. So here's a case where I went ahead and I took pre-op photos. I didn't realize that the central incisors, well, I didn't notice that the central incisors had different tissue heights. And this is a woman with kind of a gummy smile. So when the case came back and I tried it in, I realized that I wasn't going to be happy with one of her central incisors. So what I did was I seated the case, except for the central incisor that was too short. I went in with my laser, and I brought the tissue up just a little bit, and then I made her a custom temporary, and I sent the original veneer back to the lab to add tissue. Why did I do that? Because if you had the laboratory try to match it, it would never be exactly the same. So here she is with the case seated and finished. Implants with veneers. So this is a case where we're actually going to keep the central incisors natural. I bleached his teeth. We're going to do veneers on the laterals because they had a little bit of a funky shape. And then the two canines are temporary crowns that are implants. So here's the case prepped with the temporaries on. And you can see how we've shaped the tissue there. Now, when we go to seat the case, we're using zirconia abutments, and the laboratory paints a low fusing porcelain over the zirconia that we can etch, so we can actually bond the crowns on, just like we were bonding it to tooth structure. So here they are etched. Here we go. We're etching everything. You see the difference? How the material's etched now. We go ahead and screw these in. Now, once I screw these in, these were Nobel, so this was 35 Newton centimeters squared. I use flowable composite right into the screw holes on top. I do that to lock it in. I have never, ever, ever had a case fail or become loose since doing that. And I've been doing this for over 10 years. So empirically, I can tell you it works. If anybody knows anything different, please tell me. So now the implants are in, and we put some composite in there. And now we're going to try in the implant crowns with the two veneers. And you can see how beautifully everything matches. Sometimes we use pink porcelain. This is a young man. We did his case about 10 years ago. And for some reason, 21 started to resorb, and we had to extract it. It also, as you can see, started to, by itself, just intrude, which was really bizarre. So after thinking about the best way to restore him, this guy's a pretty well-known actor, we decided to basically extract that tooth. It's so weird that this is so far behind. Okay, I'm just hoping that there, okay. Well, I guess if there was a problem, Jana would call me. All right. Okay, all right. It's weird because what I'm seeing on my screen is not what I think you're seeing on your screen. But yeah. So what we decided to do was, instead of extracting 21, we basically cut it off and kind of buried it because it already had an endo. And then we made him a 3-unit bridge. They grafted a little bit of tissue over that. And then we use pink porcelain. And what we do is, I mean, if you're lucky, you can find like a shade tab that's going to match. But typically what I do is I use this kit by Cosmodent, and I blend the different pink colors to get an exact match of the tissue, which is pretty close there. And the laboratory is going to place that on the gingival aspect of the pontic in order to make it not look like he has a long tooth. So here he is finished with the new bridge. And as you see, there's pink porcelain up on top there that blends in with his tissue. So this was before, and this is after we cut the crown off. It had resorption in it, it cracked, and that's why we had to remove that. So perfecting tissue support with implants is a little tricky. So here's a case where the patient didn't like the fact that he had a space between his two front teeth. He wanted me to close that space. He had implant crowns on his laterals. And I said, well, once we close that, you're going to have diastemas. He said, that's fine. Let's change the implant crowns as well. So first thing I did was I made him a retainer, and I closed the diastema on his centrals. So here's his before picture. So here it is closed. And now we're going to change these implant crowns. This is before we took out the crowns. They were screw retained, which made it much easier for us. We went ahead and unscrewed them. And then what I do is I put a lab analog into stone, and then I screw his implant crowns into the stone, and then we use impression material and go around that. Why are we doing that? We're doing that so we can make custom abutments that will really be adapted to the tissue. So once this dries, we go ahead and we take those crowns out, and then we put in the impression copings, and we flow composite around that. So this is just flowable composite that we float around it that will adapt to the tissue exactly the way his old crowns did. I always mark it with a little mark on the front so that we know where the which direction to orient this in. And we'll go back to the mouth and place these in, and we'll pick these up in our impression. So when we pick these up, the lab will now have a perfect simulation of his tissue. There's the impression. And there's his finished case. And look how beautifully adapted the tissue is. And look how beautiful these crowns are, how they match with the translucency and the shade and everything. And he was quite happy. This was one of the hardest cases ever. So this patient has literally been my patient for 35 years. Right after I did my residency in Switzerland, I came back to the States, opened up a practice. He was one of my first patients. He's one of the biggest agents in Hollywood, and a really tough case. So what had happened was 21 and 22 were lost. He had endos on both those teeth years and years ago. We lost them. So we placed 2 implants there. And before restoring this, I looked at the tissue and I thought, you know, we should do crown lengthening on 11 and 12 in order to match it to 21 and 22. So here he is with temporaries on. Here he is immediately after the crown lengthening, healed a bit. Here's the preparation. So we go ahead and we prep. So we ended up doing his 6 teeth. So I did 3 veneers on the right, and then the canine lateral and the central. The other central lateral will be implants, and then another veneer on the canine. Same deal. We went ahead and we put 2 lab analogs into stone, and then we screwed his temporaries in because we had adapted the tissue to support perfectly underneath these temporaries. Remove those temporaries. Now we put 2 impression abutments in and flow composite on there. Now you see how it supports the tissue perfectly in his mouth. We'll pick that up in our impression. And here's his finished case. And look how beautifully symmetric we were able to make, you know, the crowns with the tissue, with the veneers, with everything. I mean, this is really the goal. So I want to take a minute and talk to you about my LEAP Foundation. For those of you who have kids that are 15 to 25. The reason we're doing the seminar in the UK is because the proceeds from the seminar are going to go to the LEAP Foundation. LEAP is a nonprofit that we established about 16 years ago. It's an entrepreneur leadership and motivational program, and we've had phenomenal speakers: Sir Richard Branson, Paula Abdul, Mark Wahlberg, Michael Strahan, Kathy Bates, Anthony Hopkins, two great Brits, and a lot of other great people. And basically what we do at LEAP is we teach kids skills that they need to learn to be successful in life. And we do it through mentorship, we do it through lectures, we do it through interactive programs. It's really a phenomenal program. I became very close friends with the mayor of Perth. She sends 40 students from West Australia every year to come to LEAP. So, the proceeds from our lecture will go to sponsor students who come from low-income families that could never afford to go to a program like this. If any of you are in Los Angeles, July 16th to the 22nd in 2023, and you'd like to stop by, please do. I mean, I'm there 24/7. It's a really phenomenal program. And I always feel like if there's just two things that I want kids to walk away from when they go to LEAP, it's this. One, don't wait for opportunities in life, make them. If I meet another millennial who tells me they're waiting for the universe to do something for them, I just want to bang my head on the wall and say, no, the universe doesn't care about you. You need to care about you. And two, when you get an opportunity in life, don't take it, master it. Listen, when ABC put me on Extreme Makeover, dentistry, no problem. TV, I stunk. I mean, literally stunk. Like, they should have fired me. But at least I was smart enough to know how bad I was, and I did something about it. I took acting classes, hosting classes, teleprompting classes, because I realized what a great opportunity it was, and I didn't want to get fired. So don't take opportunities, master them. So LEAP will be July 26th through the 22nd. If you want more information, our website's www.leapfoundation.com. What do we teach them? Goal setting, time management, interviewing, networking, mentorship, communication, etiquette, really etiquette, like which fork to use, public speaking. And we have great business leaders, entrepreneurs, artists, athletes, and whatever. I mean, the program culminates on Friday with something we call a mentor workshop, where it's like speed dating. Every 30 minutes they rotate, but they get to talk to these amazing mentors who come to the program. Chris Paul, he's an American basketball player. Paula Abdul, Scott Hoying from Pentatonics. I've been working with the Pentatonics group since they started. Our mayor, Eric Garcetti's come. Mark Wahlberg has come. Anthony Hopkins has come. 99% of alumni say that LEAP helped them prepare for success. 98 are more motivated after attending LEAP. 91% are more confident after attending LEAP. And 100% of the students leave with well-defined vocational goals written down. And we hold them to it. It's not like a one and done. It's not like 1 week and we're finished. We literally will call these students through their small groups. When they come in, we put them in a small group and they'll have a coach. And that coach will go through and kind of check in with them. So please take a picture of this slide. It gives you our website and the dates. And if you need to contact me, this is the best way. I know I have 1.6 million people on Instagram, but I actually answer all my DMs. So if you DM me, I promise you it is actually me. I don't do Facebook. That's not me. I don't do TikTok. That's not me. I mean, I have it and I hire a service that does it because it's important. I don't do Twitter. I don't even answer Twitter or even look at it, but I actually am on Instagram. So if you need to get a hold of me, the best way is to either email me or DM me on Instagram, and I promise you that is me, and I will respond. And I think we finished on record time. If we have any questions, I'm happy to answer them.
Okay. So Bill, there's been a couple questions here, if you could answer them. One of the questions was, can you go through how you prep your veneer prep protocol? Just looking through your photographs, your veneer preps, how do you prepare them? If you could just go through those slides.
Yeah. So here's the thing, Jana. When I do the full day program in London, I will actually show you with video. We don't have time to do it here. This was really just kind of a teaser for the big program, but I will go through it in detail and you'll actually get to see me prepping teeth. So we'll save that for when I'm in London. I hope all of you show up. It's going to be an amazing event. And Jana found some really, really interesting and great speakers to come and speak along with me.
Amazing, amazing. That's great. Other questions here. Well, where can you find out more about your London seminar? Laurie, if you're able to take over now and just give them a run through of the website and how they can attend and get their early bird tickets.
You guys have a photograph of the website with the web address and all that. Maybe you can put that up, Jana.
Yes, I think Laurie's going to do that now. Yeah. So if you guys go over to dentistry.co.uk and you click on shows, the first thing you're going to come up with on shows is going to be Den Studio International Conference. So once you click on there, it will give you some more information exactly about the event itself. We've got a very limited number of tickets because we haven't got a huge hall. Hence why if everyone on this webinar was to book a ticket, we wouldn't be able to fulfill those ticket needs. There's an early bird ticket until the end of this month, which are going pretty fast. So it's only $195 for the entire day event. If you scroll down, Laurie, I'm going to show you a little bit more details about it as well. We've got Dr. Miguel Stanley talking. We've got Dr. Bill Dorfman doing 2 of his lectures. Dr. Ben Atkins. Also, Dr. Jamil from Scotland is making an appearance as well. Dr. Majnaji from the UAE is flying in just for this event itself. As Dr. Bill Dorfman said, he's going to go through this lecture in more detail. Like, it's going to put these videos, so it's going to be hands-on. And Dr. Ash Palmer as well, one of the mentors for a lot of dentists in the UK, specifically said Bill Dorfman is the reason why he does cosmetic dentistry and one of the great mentors for him as well. So it's going to be a great day to get everyone together, and we're going to learn so much through this day, especially if you're big on aesthetic dentistry and want to do more of that. Please make sure you do attend. Again, we're going to be networking with all of these big names and experts as well, get to meet them in person, get advice straight from them. Refreshments will be included, and an engaging question and answer session from all of these big guys, and 3 of the biggest guys in the UK, and from our board as well. It's a never been done event before in the UK, and it's probably only going to be a one-time thing that we do, because getting someone like Bill Dorfman, for example, to come down is a very hard thing to do itself. So it took me years of convincing him to be able to.
Yeah, he really has. And Jana, we should tell him the way that they've structured the ticket sales is kind of like the airlines do. So, for instance, the first 50 tickets that will be sold at this reduced rate. And as they sell more tickets, it will cost more and more. So if you want to go to this seminar, and it's going to be phenomenal, buy your ticket early, because the longer you wait, they may even increase the price before the end of the month if they've sold out in the first batch of tickets. So I think every 50 tickets, it goes up a little bit. So if you guys want to come, please do that. I'm super excited to come and meet you and spend the day there. And you can ask me as many questions as you want. I'm an open book, and I love helping dentists become more successful.
Amazing. Thank you very much, Bill. Over to you, Laurie.
Well, gentlemen, thank you so much for both being here this evening. Dr. Bill, I know you've got a really busy schedule, so I think we'll wrap it up here. I just want to say thank you again. So excited to host you. Can't wait to meet you in person in London. And we will, of course, send the sign-up details to everybody who's attended the webinar tonight. And do make sure you sign up quickly before the tickets go. So thank you, and have a great evening, everybody. Good night.
Good night.